Hi friends, today in this topic of respiratory system examination, I will talk about expectoration. First is the disclaimer. Caring Dog YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Expectoration or sputum production is when the patient coughs. We should always keep a sputum pot near the bed of the patient who has cough. Sputum can be described under the following heading: quantity, quality, and the odor. Normally, a person produces 10 to 15 ml of sputum per day, and when the production of the sputum is more than 100 ml per day, we call it as a bronchorrhea, and it is seen in bronchiectasis, lung abscess, bronchoalveolar carcinoma, and organophosphorus poisoning. The foul smelling sputum is seen in patients with anaerobic infection, for example, anaerobic infection seen in lung abscess and bronchiectasis. The quality of the sputum can be mucoid, mucopurulent, purulent, rust colored or purulent sputum, currant jelly or sticky sputum, blood tint, foamy sputum, greenish, granules, yellow or black, anchovy sauce, and at times black. The mucoid or mucoid sputum is clear sticky. It is not necessary that it is produced in large amount. It is seen in patients with chronic bronchitis and bronchial asthma. Mucopurulent sputum is seen in patients with infections, especially bacterial infections. And purulent sputum, it is seen in patients with lung abscess, bronchiectasis, and pneumonia. Occasionally, the asthmatic patients may have a yellow tinge to the sputum due to the presence of many eosinophils. So, people with asthma may also produce a particular tenacious form of mucoid sputum, and sometimes they cough up cast of the bronchial tree, particularly after an attack. The rust colored or purulent sputum, it is seen in pneumococcal pneumonia. Currant jelly and sticky sputum is seen in Klebsiella pneumonia. Blood-tinged foamy sputum is seen in pulmonary edema, that is pink frothy. Greenish color sputum is produced in Pseudomonas. Granules like yellow granules or black granules is seen in patients with actinomycosis and aspergillosis. Anchovy sauce or brown colored sputum is seen in patients with amoebic liver abscess which has perforated the diaphragm and spread to the lungs. Black sputum is seen in patients with carbon particle discolor. The carbon particle they discolor the sputum as grey in patients with cigarette smoker, or at times it can be black in coal miners. The blood may be coughed up alone, or blood stained sputum may be seen in patients with bronchogenic carcinoma, pulmonary tuberculosis, pulmonary embolism, bronchiectasis, and pulmonary hypertension, especially in patients with mitral stenosis. These are the different colors of the sputum which can be seen in various conditions as described in my previous slide. Remember some special points. Chronic expectoration of large amount of purulent and foul smelling sputum is strongly suggestive of bronchiectasis. Sudden production of such sputum in febrile patients indicate a lung abscess. Three-layer sputum consisting of foamy upper layer, mucus middle layer, and viscous purulent bottom layer is pathognomic of bronchiectasis. Means in bronchiectasis we get triple layer of sputum. Upper layer is foamy, middle layer is mucus, and the inner layer is or bottom layer is viscous purulent. When we see postural variation in the sputum, it is seen in patients with bronchiectasis and lung abscesses. Observation, reason, human understanding, courage, all these make the good physician. It was said by Martin H. Fisher. With this, I conclude my today's topic. Thank you. Keep learning.